And we are back with Cone Health's Chief Physician Executive, Dr. Bruce Swords, and we're answering your questions about the coronavirus. You can post them on Facebook, or you can text them to the number that is on your screen, right there on the side there, 336-379-5775. So first, we are spread apart like this on purpose. We are practicing social distancing, and it really is just this simple.
It really is. It is a matter of staying away from people respectfully and not gathering in large places, not going to areas that you know are going to be crowded. The more people you're around, the more likely you are to become infected, and the more likely you are, on the off chance that you are infected, to transmit the disease.
All right, so we have several questions here from viewers. This person says, I have a red swollen throat since Friday. I've been tested for flu and for strep. They both came back negative. I wake up today with cough and congestion. What should I do?
It's a really good question, and it's appropriate to have some concern and wonder what's going on. So I'll remind everybody that coronavirus is not the only virus that is out in our community. There are viruses all over. Simple cold, most coronaviruses, and there are lots of them, cause a cold. There are other viruses that just cause the cold. And so as long as it is sore throat, cough, simple congestion, without fever or shortness of breath, the best advice is to wait it out and you're going to get better. And that's what happens even if you had the coronavirus. That's really what happens with most people. Mild illness, moderate illness sometimes, and folks get better.
Well, some people said that they were taking ibuprofen for other things and that they heard through the rumor mill that ibuprofen made them maybe more susceptible because of the coronavirus. Anything to that?
There's lots of rumors out there. There are a lot of rumors around the coronavirus, and finding out facts is important. It's the title of this segment. And there is no evidence that ibuprofen, also known as Advil, there are other brand names, contributes or worsens coronavirus in those folks who are infected.
Okay, so this is a simple question. Can you tell me the symptoms to watch for coronavirus?
Yeah. Symptoms are commonplace for multiple viruses. So fever, cough, chills. We start getting concerned when people are short of breath, can't do their normal activities without feeling some sense of maybe air hunger or shortness of breath. That's where we would start being concerned. I think it's reasonable to call your physician or seek virtual care under the circumstances where you have a fever, cough, shortness of breath, sore throat could go along with it. So it's typical symptoms, signs and symptoms of perhaps a flu or a simple cold.
Okay, someone on our Facebook page, she says, I'm 27 weeks pregnant. How likely am I to contract the virus? And if so, how severe are symptoms? Who has the mild and severe symptoms, and what do each of those look like?
So you're pregnant, congratulations. Your likelihood of getting the disease is low. There are, just as a reminder, there are no confirmed cases of coronavirus, COVID-19, in Guilford County or in the other areas that Cone Health primarily serves. There are documented cases in adjacent counties, but none in the counties that we serve. So your likelihood of getting it's low. Remind me the rest of the...
And then she wanted to know how severe are the symptoms, who has the mild and who has the severe symptoms, and what do they look like differently?
So the symptoms went through fever, cough, shortness of breath would be the primary ones. You're more likely to have severe symptoms if you're older or have chronic conditions, chronic lung conditions, chronic heart conditions, diabetes, those sorts of things. You're more likely to have or suffer from severe symptoms. As a healthy, pregnant 27-year-old, it's less likely.
Okay, and then someone said, is it okay to go to the gym or a small business that remains open right now?
I'll say the short answer is yes. So a small business that doesn't have large crowds, yeah, it makes perfect sense. We have to go about our business and use some common sense. Gyms, I would also say it's really important to stay healthy at this time. I'm a big believer in exercise. We should do it frequently. And if you go to a gym when it's very crowded, it might be a time to alter your habit a little bit. And when you're at a gym, make sure that you wipe down the equipment. It's important, most of the time, it's really important now to make sure that before you use general equipment, wipe it down and make sure it's clean.
Someone said, if people have surgeries planned, should they go through with them while the coronavirus is out there?
It's a really good question. And so the Surgeon General has put out some recommendations around surgeries, as has the American College of Surgeons. And so they will refer to the term elective surgery, and elective surgery is not necessarily defined. So it could be something as simple as a child getting tubes in her ears, and it could be someone who is getting elective surgery for a malignancy, a cancer. So both elective, but both have different outcomes and urgencies associated with them. So the right answer for now, and perhaps into the near future, it's really conversation to have with your physician. Ask about the risks, ask about the risks of delaying the surgery and the risks of having the surgery in the healthcare environment.
Gotcha. Okay. Now we're going to be back in just a few moments, and we want to make sure that we're getting your questions answered. So again, you can text us your questions, 336-379-5775. Again, this is a text.